Coming to surgery, like still the gold standard, but in a carefully selected patients based on deeper submucosal invasion, lymphovascular invasions, and histology, which are poorly differentiated, and multifocal diseases. This study from Korea, it's a randomized control trial published in 2019, analyzed laparoscopic distal gastrectomy versus open distal gastrectomy in stage 1 gastric cancers. 1,400 patients were divided into two groups, 700, from 13 different institutes were included. This showed similar overall and cancer-specific survival rates. Therefore, laparoscopic distal gastrectomy is an oncologically safe alternative to open surgery for stage 1 gastric cancers. The other similar study from Japan, published in 2018, Lancet Gastroenterology, studied laparoscopic versus open gastrectomy in EGC, a phase 3 non-inferiority study. It showed similar relapse-free survival, and the recent update in this study was like health-related quality of life, which is non-inferior and better. So laparoscopic assisted distal gastrectomy is also strongly recommended in stage 1 gastric cancers. This study, like the plan for lymphadenectomies in early gastric cancers. To be precise, not aggressive, the study from Japan, like sentinel lymph node mapping, it included like T1 and 0 patients. Like dual taser technique was used, blue dye and radioactive colloid both were used in this study, and sentinel lymph nodes were mapped whether laparoscopically or open approach, which helps in limiting lymphadenectomy in select early gastric cancer patients, thus opening the future gates of organ sparing surgery become standard for low risk early gastric cancer. Coming to the molecular and genetic research, as we already seen in the earlier lectures, like molecular subtypes of gastric adenocarcinoma, like Epstein-Barr virus, microsatellite instability, genomic stability, and chromosomal instability, they divided into 4 different molecular subtypes. The future directions, definitely AI plays an important role in management as well as diagnosis of early gastric cancers, and liquid biopsies like circulating tumor DNA helps in detecting recurrence months before imaging. And precision endoscopic therapies like endoscopic submucosal dissection plus adjuvants, which the adjuvants were like novel photodynamic therapy to eradicate residual cells. And immunotherapy and targeted therapies in early stage. This was published in 2024 by Park et al. Endoscopic submucosal dissection plus checkpoint inhibitors in EGC. This tested boosting immune response right after tumor removal can prevent recurrences. The results were like the recurrence rates dropped by almost 50% compared to ESD alone at 2 years of follow-up. And this demonstrated robust immune activation seen in tissue samples after immunotherapy, and the safety profile is excellent. The current international guidelines we have seen like Japanese gastric cancer treatment guidelines. The updated version is in 2024, gold standard for EGC management with evidence-based recommendations. And the NCCN 2024 guidelines recommend MSI-H testing as a standard of care for all newly diagnosed gastric cancer patients. Thank you.